Hi, welcome to our Roundtable series. This is where you get an insider scoop right from our medical providers on how you can become an advocate for your healthcare, one topic at a time. Today, I'm here with Dr. Madan Kandula and Dr. Ethan Handler, and we're going to be talking about mouth breathing. All right, gentlemen. So, for those people who maybe think they have it or not, what is mouth breathing and why should somebody care?
Mouth breathing is a menace, right?
Mouth breathing is a menace.
No, mouth breathing, I guess my take on mouth breathing is something that nobody would choose to do. Right? Like it's not natural, it's not normal. If the only time somebody will do it is if they have to do it. The only time somebody normal should have to do it is if like they're exerting themselves beyond their capacity to breathe through their nose. Which, yeah, if you're like running sprints, fine. If you're sitting, in your easy chair watching TV, it shouldn't be happening.
I would agree, yeah. So Dr. Kandula and I were recently at a lecture where I think there was an interesting statement that had been made that, you should breathe through your mouth as much as you eat through your nose. And it's a simple statement, but it makes total sense. And I think that's kind of the ethos of what we do here is that we are not designed to breathe through our mouths unless we have to, if we're running or something like that.
This is the way it is 100% of the time, is if a kiddo comes in, mouth hanging open to their pediatrician's office, and even mom or dad says, hey, what's up with this mouth breathing? I pretty well know the answer is going to be, it's not a problem, he'll probably grow out of it, no big issue.
Right.
Versus, that's a problem. That's going to create a situation. It's going to create a domino effect that is going to ripple through that kid's life, irrecoverable. It's just there's not a way. Once somebody has grown and sort of is done growing, then that's how they're built, and the damage is done basically.
Right.
The first domino to tip is a nose that doesn't work, and a nose that doesn't work causes a mouth to be open to breathe, and a mouth that's open to breathe causes somebody's facial structure to not form properly. So meaning when we say that, or when I say that, I mean, instead of what you do not want, from an airway standpoint, is you don't want your face to be narrow and elongated. So that narrowing and elongation means, if you think about it, that your airway is now narrow and then your face is sort of shoved back on it. So what you ideally want is somebody's face to be, wide, and that if you think about aesthetically pleasing faces, it's actually wide cheekbones. That's what you want. And so if you've got a kid who's got a nose that's not working, his mouth breathing, then all of a sudden what should be growing this way is all of a sudden not. And what happens then, what we've come to understand, is then all of a sudden somebody's nose that was supposed to be wider from a nose standpoint is a triangle. So the wider the triangle, the more open it is. The narrower the triangle, the more narrow it is. And so somebody's nose isn't as big as it ought to be. Means it's not going to be working as well. If somebody's airway is not as big as it ought to be, it just creates. And then once that's set, once you've gone through puberty, once you're done growing, then
Right.
You're an adult who's got sleep apnea that we've got to sort of pick the pieces up, and we can certainly help, and that's really important. And there's millions of people out there that need that help, but there's also millions of kids and younger folks who are on that same pathway that we could get off that pathway.
Yeah, I mean, there's catch up to be done, but if you can treat the cause early, you can prevent the ramifications from that. And so, it's not a knock on pediatrics or pediatricians, and it's just that this is kind of the niche that we land in, and they have such a broad array of things they have to handle among kids that, there might be this perception out there, certainly, that snoring, you'll grow out of it, or it's no big deal. And again, my wife and I had that same discussion with our kid. It's like, hey, what if a pediatrician sees thousands of kids per year and they only send 20% for referral because they're snoring? Doesn't mean those other ones aren't a problem.
Mm-hmm.
Doesn't mean those other ones shouldn't be treated. And I think that tonsillectomy being as common as it is, and obviously there are certain kids that get tonsillectomy and adenoidectomy for sleep apnea, and I think there's definitely strong reasons for why that should be done in cases. But there's a whole group of kids who might have that procedure done and still have problems after. And then it's like, well, what do you do with those kids? And was that the right procedure necessarily to start with?
Mm-hmm.
Because maybe they're still mouth breathing, and maybe they're still having attention problems at school and not sleeping well. And so the question is, well, was the nose ever thought about and addressed?
Mm-hmm.
So, you guys mentioned the ripple effect. And in regards to whether it's a parent that has a kid, or maybe you're a grown adult and you are identifying with everything that you've talked about, what should a parent be doing? What is that next step, or those next few steps that a parent should be doing to make sure that their kid isn't growing up and having these long-term issues?
The medical system is not really equipped to answer a lot of these simple questions. Reality is if a parent is concerned about their child's ability to breathe, and especially breathing through their nose, and they go in to almost, unfortunately, anybody in the medical community right now, they're going to get turned away. And so I think that's the challenge. That's wrong. And if you go in to see, your doctor, your dentist, whomever, and they dismiss that, understand that that's wrong. You're right as a parent. You're right as an adult if you have these issues to say, it doesn't mean you have to be disrespectful, but I'd say acknowledge. I think this is where, and I think there's a untold truth in medicine, which is you as a person and as a parent of another person are the steward of your own health, and meaning that if you identify something as a problem and you want to find a solution, that sometimes you've got to kind of push through a system to get an answer, because the typical answer a lot of times, especially for the issues that we're talking about, the typical answer is going to be to dismiss your concerns out of hand. Part of that dismissiveness is lack of understanding. Part of that dismissiveness is lack of any active option to make any difference. Having the comfort and confidence for those people to understand that we're not going to dismiss those issues, that we identify them as real issues and we have real solutions for those issues. So there is sort of this is a place, if somebody has these sorts of concerns, that they can go and, we'll at the very least have an understanding about what's going on. At the very least, you'll have an understanding about, what's happening, what your options are. And then that, to me, I'd say that's it. Meaning that's that first step. That's what you need to get as a first step. You have to understand what's happening. We don't leave it there. So we're going to talk about various solutions, and we're going to talk about the pros and cons of those various solutions. And then you're going to sort of take that information and you can bounce stuff off of us as far figuring out what's the right solution for you. And if you know what's going on, you know what your solutions are, and you choose not to do anything about it, more power to you. That's fine. Like that, I don't have any issues with that whatsoever. And even for somebody who's sort of not a proponent or an advocate of being proactive with these issues, if they're giving you a good understanding, you know what's happening, you know what you could do, and and they sort of steer you in a direction towards just keep an eye on it. That's okay. I guess for us here, it's understand, explain, and how I'm wired is if I see a problem, I want to solve it. And how we're wired here is we see a problem and we want to solve it. Now it's your body and it's your decision to make, but that's our attitude. That's another sort of undertold reality is that doctors are people too.
So let's say for somebody who maybe thinks that they might be a mouth breather when they're up, but maybe are there signs or ways that they could tell if, say, they live by themselves and they're not sure, maybe they're doing it at night, how can they identify that?
I don't know percentages. I'd say a lot of mouth breathers don't know that they're mouth breathers. Some do. Some folks have only ever known breathing either mainly or mostly through their mouth, and so how would they know any different? I would say some clues. A clue is if somebody is seeing you with your mouth hanging open, then you're a mouth breather. Basically, it's not rocket science that way. I think when somebody's sleeping at night, I guess I'd say, how do you know if you're breathing through your mouth when you're sleeping at night because you're asleep? Well, I'd say if you wake up in the morning and there's drool on your pillow fairly consistently, or ever. Like pretty much ever. Like if there's drool on your pillow, you're a mouth breather. And if there's drool on your pillow every night, you're a mouth breather.
Or if your mouth is super dry.
Or your mouth is super dry. Either of those things. Like you wake up in the morning, or another clue is, do you have to have a glass of water by the side of your bed? Well, maybe you're just like you need to be hydrated, maybe you're breathing through your mouth. So I'd say if a subtle clue is like, do you have to have a glass of water that's sitting there? Do you look at your pillow? Do you kind of wipe the drool off your pillow in the morning? That's a big time clue. Yeah, are you waking up with your mouth feeling like it's bone dry? Yep, that's a problem.
I genuinely believe that parents will advocate the best for their kids. And I think that most of us can kind of say that that's true. And I do, and you have, but most parents out there will do that. And so I think that one of the important things is coming to Advent, they can discuss with us the various options that we have. And we may not think like the rest of the medical community does. But I think that there are plenty of parents out there, we've seen these kids that have kind of thrown their hands up in the air and say, I don't know what else I can do, and have laid out for us the other things that they've done, and realize that there are different ways of thinking about it, or different ways of doing something.
So, gentlemen, our conversation's coming to a close. Any last comments? Or maybe a closing tip for anyone if they're ready, they know their significant other or a friend is a mouth breather. What's a gentle way to kind of have that kind of conversation?
Yeah, it depends on the relationship, honestly. So, it's tricky. Why do you care that somebody's mouth? Why would you care that your spouse is mouth breathing or your child is mouth breathing? Generally, because you care about them. If you cared about somebody, I guess it gets back to what I was saying before. If you care about somebody and you see they've got an issue, then it's again, from a place of care and concern and love, of pointing it out in a gentle manner and pointing out the sort of repercussions of this issue. But it's just pointing out why it's a problem, and why it's probably more of a problem than you know about, and then also pointing out that there's some simple options nowadays.
Right. Well, thank you so much for your time, Dr. Kandula and Dr. Handler, and thanks for tuning in. Stay tuned for next time.